It's a hard truth. Millions of men deal with erectile dysfunction. ED means ongoing difficulty either getting or keeping an erection. It can be frustrating and embarrassing, but it's more common than you might think. And it's not just in older men.
I think the most common misconception that I talk about and see in my practice is that ED is something that's rare.
This is Dr. Marah Hehemann, a urologist at the Men's Health Center at UW-Medicine. She sees a lot of patients with ED.
Many men coming to us to talk about ED really feel alone. They feel that they can't talk about this with friends, they can't talk about it with their partner, and they feel really isolated and stigmatized. And what I would just remind folks is that this is incredibly common. We like to say it sort of scales up with age. So in the age group of 20 to 30, about 20% of men are experiencing ED. Men in their 30s, it's about 30%. In 40s, it's about 40%. And so by the time men are in their 80s, about 80% of men have some level of erectile dysfunction.
As awkward as it can be to talk about ED with your doctor, it's important that you do. Problems in the bedroom can be an early sign of more serious health problems, like heart disease. To understand why, you first need to understand the complexities behind a normal erection.
I think in the media, we see that erections are so easy for men, but in reality, we know that there are many men who have challenges. And it's important to understand that there are 5 bodily systems that play a role and can have difficulty that contribute to erectile dysfunction.
Those 5 bodily systems are blood flow, nerves, penile tissue, testosterone, and mental health. If there's an issue with any one of these systems, it can put you at risk for ED. But in many cases, a blood flow problem is the primary contributor.
There is this concept that ED can be the canary in the coal mine for cardiovascular health. Blood flow into the penis can be affected earlier than blood flow into the heart because of the anatomy of the penis. There are 2 very small arteries that supply the blood to the penis, and they're about 1 millimeter in diameter. So that is a tiny channel to supply all the blood to the penis. If you think about the heart, those arteries are about 4 millimeters in diameter, so they're much bigger. And if someone has plaque or atherosclerosis that affects the blood vessels in the body, they're going to impact the smaller vessels first. So when we see young men with ED, that can be a signal that they may need to see a primary care doctor or advanced practice provider who can evaluate their cardiovascular health.
This is especially important if they have a family history of cardiovascular issues, like heart attacks or strokes. Since ED can indicate broader health problems, treatment often involves making lifestyle changes, losing weight, exercising regularly, managing high blood pressure or cholesterol. Limiting alcohol and quitting smoking can help. What you eat is important too. Increase your vegetable, fruit, and whole grain intake. Focus on lean proteins and limit how much processed food you eat, especially processed meat.
In particular, processed meat has been shown to be negatively impacting erectile function, and in my role as an infertility specialist, also negatively impacts male fertility.
This is thought to be due to the high levels of sodium, nitrates, and fats found in processed meats.
So diet, exercise, weight loss, and reducing sedentary activity. All of these things have been shown independently to help with erectile function.
The next tier of treatment after lifestyle changes? You guessed it, medication.
Drugs like tadalafil, sildenafil, and vardenafil have been FDA approved for 30 years now and are used very commonly worldwide. These are very safe medications that can be prescribed by a general practitioner. You don't need to see a urologist.
There are also experimental treatments, like shockwave or stem cell therapy. But before spending money on them, you should talk with your doctor to see if you're a good candidate, because they aren't effective for everyone.
While it can be difficult to bring up the topic of ED with your partner or with your provider, you should try to feel comfortable with this, because sexuality is an important piece of your overall health. And we know that when sexuality is suffering, quality of life can suffer as well. It's important to know that you're not alone, and there are providers that are here to help you. We have many different treatment options, and help is just around the corner.